Today's topic is very interesting in a sense that people who suffer from it won't admit, and those who don't suffer announce blatantly. Obsessive compulsive disorder, as a short we call it OCD, consists of three elements: thoughts, obsessions, and compulsions. An obsession is an unwanted and unpleasant thought, image, or urge that repeatedly enters your mind, causing feelings of anxiety, disgust, or unease. A compulsion is a repetitive behavior or mental act that you feel you need to do to temporarily relieve the unpleasant feelings brought on by the obsessive thought. In other words, obsessions drive compulsions and compulsions relieve the obsessions. As a matter of fact, OCD is the seventh most debilitating illnesses of all the illnesses, including psychiatric and physical illnesses, including hypertension, diabetes, and cancer. It is astonishing that around 2 to 4% of population suffer from some form of OCD. The reason it doesn't seem that common is because OCD sufferers try to hide it from others as a matter of shame. In some cases, OCD takes over someone's life by wasting their time while they have to do more important things in life. Thoughts come to mind recursively, which is very distressing for some people. It becomes a big problem when they are unable to focus on their work because their attention is divided between unnecessary, intrusive thoughts and their work. Some of the thoughts are gross. The sufferers doesn't want those thoughts to come to their head, while some of the thoughts are weird fantasies, like standing on top of a bridge and thinking, what if I jump? That sort of weird thoughts. The positive thing is only having a thought is not as bad as taking action based on those thoughts. OCD is divided into three types of obsessions and compulsions: checking, repetitions, and order. In checking a light switch or a gas stove or a door lock more than once is considered abnormal. For example, if we drive our car to somewhere, let's say supermarket, and we park the car, and then a thought comes to our head, did I lock the car? And we go back and check the car if it is locked. It is quite normal. But what if we do this several times? Let's say 5 times or 10 times. This is not considered as normal. Similarly, if we turn off our gas stove and then we forget, did we turn it off properly? We can check it once, that's fine. But if we do it several times, it is obviously taking over our life because we are not feeling comfortable whether the gas stove is on or off. The second thing is repetitions. Counting up to a certain number and then backwards. Some people have the habit of counting a number up to, let's say, 5, 7, or 10, and then counting it backwards several times, which is a strange thing to do. But this thing occupies the mind, so they are unable to perform their daily life and they are wasting the time and things like that. If we take example of a cashier, we go to a bank and we need to deposit, let's say, £200, and we hand the cash over to the cashier. They will take the cash and they count it. Maybe they use a machine and then they give you the deposit slip. But if the cashier suffers from OCD, they will count the cash maybe 5 times or 6 or 7, so many times, which is very, very abnormal, and it can cause distressing feeling for the person because they're taking so long to perform the job. The third thing is keeping things in order. It also causes a big stress in someone's married life. If, for example, the husband suffers from OCD and they want to keep things in order, the shoes, the clothes, even in the kitchen, the utensils and cutlery and everything is in order, and the wife is not bothered about it, obviously they will have some kind of resentment, like they have the expectation the other person also behave the way they want them to be. Or it's vice versa. If the wife suffers from OCD and the husband doesn't abide by the rules, obviously it causes a problem. Keeping things in order, it also applies to the cleaning of the house as well. Is where the one person is cleaner than the other, then it causes a problem in the relationships. Up to here, the things are under control to some extent. But the next thing is worrying when OCD start causing anxiety. If you want to know more about anxiety, I can briefly explain. Anxiety is a heightened state of autonomic arousal, in which you have sweating, heartbeat and high heart rate, and your breathing is faster. And if it happens in the presence of real danger, which is normal, that's the way we are built. But if it happens in the absence of the real danger, then this is abnormal and this comes under anxiety. Some people have phobias like flying in a plane or riding a bike, which sounds a bit strange, but yes, people do have phobias. So statistically, flying in a plane is considered to be most safest thing to do. But for some people, before they have to fly, they are anxious. So their heartbeat is really fast. They are maybe sweating, or their breathing is faster as well. That type of scenarios is like some of the examples of anxiety. The link between OCD and anxiety, some people start things in a certain way. For example, they start things from the right side, or the vice versa, they can do from the left side. If they don't do that, they believe that if they don't do that, the result can be detrimental. It can end up in a disaster. For example, if the person suffering from OCD always sit on the left aisle of a bus, thinking this is a safer place to sit, and if they want to use a bus to go somewhere and they enter the bus, but the left side is fully occupied, they might get off the bus, and if they miss the bus, and there might not be next bus coming for next 15 minutes or half an hour. As a result, they might be late for work, or if they need to catch a plane, they might miss their flight. That can be very distressing for the person. So anxiety to the level that OCD sufferer injure their hands due to excessive washing is another problem. Some people believe there are germs everywhere. For that reason, they keep washing their hands. They keep washing their hand to that extent, the hands are literally bleeding. Let's look at the scientific proof. Dozens of studies have identified the circuits and parts of the brain that take part in OCD cortex, striatum, and thalamus. Cortex is the outer part of the brain, and the striatum is one of the principal components of the basal ganglia, whereas thalamus is egg-like structure in the middle of the brain. Cortex is responsible for understanding and perception and decision making, whereas striatum is like on-off switch, where you make a decision, go, no go, do or don't do, that type of things. Whereas thalamus, all the sensory input passes through it. The dysfunction in the loop of these three parts of the brain is considered responsible for the OCD. We have learned through clinical studies with the help of fMRI and PET scans. In the clinical studies, participants who suffer from OCD are observed. The trigger of OCD shows three areas of brain: cortex, striatum, and thalamus light up in the brain scans. The studies are done through triggers. The participants come to the lab and the researchers observe them using the fMRI and PET scans, where if the person suffers from OCD and they don't like dirty items, a dirty item is left next to the person, and the person start feeling the anxiety, or if the person suffers from OCD and they want to keep things tidied up, and if the things are not in order, you can see that anxiety, the person is a bit anxious, and that anxiety is shown on fMRI and PET scans. there is a lot of brain activity in these three parts of the brain, a lot of blood flow as well. If you want to know more about parts of the brain and their functions, you can watch my video. The link is in the description. Sometimes underlying reason for suffering from OCD is superstition. If you push the person to explain why do the things in a certain way, for example, sit at the end of a sofa or couch rather than in the center, their answer will be, I don't know. I have always sat there. But if you keep pushing and try to understand the reason, they will say, if I sit in the middle, my favorite team will lose the match. Or even worse might happen, someone might be harmed. Sometimes the situation can be very awkward. For example, if there are some guests in the house and the guests sit on the side of the sofa and there is no room for the person who suffers from OCD to sit on the place they normally sit, they not like to sit in the middle, and it will cause a kind of a distress and anxiety feeling in the person. You might be thinking it can't be that serious. Trust me, it is that serious. These things are proven through the clinical studies while going through the questionnaires and checklists. The interesting thing is the sufferer never try to explore the possibility. What if they don't follow the obsession and do things normally do it opposite? They never dare to do that because fear of consequences. They live the whole life under the fear, but they don't do the opposite. They will not try opposite way they do it. For example, as I give example of sitting on a sofa, they always been sitting on this on one side of the sofa, but they never dared try to sit in the middle of it, thinking something bad might happen. But there are some positive superstitions as well. People do certain things or actions before or during performing a task. For example of players. Let's say a batsman. Some of the batsmen, they tap the bat on the pitch certain times, like before playing the next ball, 3 times, 4 times, or 5 times, thinking if they don't do that, they might be out on the next ball. Similarly, with the tennis players, some of the tennis players, they swivel the racket around before playing the shot every time, thinking they will perform better if they do that. But if they don't, they might not be able to perform that standard they want to be. There is a difference between OCD and habit. For example, hand wash before and after the meal is a normal thing to do. But if it is not possible, it is not end of the world. If your hands are clean, people will carry on and they will enjoy the meal. But it is not for the OCD. It is like a life and death situation for them. If their hands are not clean, even if their hands are clean and they want to wash the hands before having the meal and the soap and water is not available, they will be reluctant to go ahead and eat the meal. But the difference between a habit and the OCD sufferer is, for a normal person, if the things are in order, fair enough. But if the things are not in order, that's fine. But for OCD sufferer, they will start feeling the anxiety in other people's houses. So that's the difference between OCD and a habit. Then there is a difference between OCD and obsessive compulsive personality disorder. In full-blown OCD is very intrusive in someone's life, like they want instant gratification following their obsessions, whereas obsessive compulsive personality disorders is not that bad. These people do things in a certain sequence and very meticulous. That can be a positive trait required for a certain type of professions. For example, if the person is a chef and they suffer from obsessive compulsive personality disorder, they will follow the recipe exactly how it's supposed to be. When they're serving the food, they make sure the dish is clean, the portion size is right, so everything looks mathematically calculated. So in that sense is a very positive thing for some people if they suffer from obsessive compulsive personality disorder. If you believe you suffer from OCD or someone you know they suffer from OCD and you want to get the diagnosis done, it is done through Yale-Brown OCD scale. There's a test to know if someone's from OCD. There are pages and pages of questionnaires and checklists where the person is asked several questions and they go through the different questions, and by end of it, the clinician can identify whether the person suffers from OCD. So what are the treatment options? The number one is CBT, called Cognitive Behavioral Therapy. In CBT, clinicians visit the workplace or home and observe the sufferer, what they do in their daily life, why they do certain things and how they do it, and try to understand the underlying fear. Why someone is forced to do the compulsion, what will happen if they don't do it. The treatment lasts around 10 to 12 weeks. The second treatment is SSRI, Selective Serotonin Reuptake Inhibitor, is a type of drug. The drug names are Prozac or citalopram, but these drugs have some side effects. They can affect people's, patients' appetite or their intimate life. Then there are two more treatments. The research is ongoing on those treatments. One is a drug called ketamine, and the fourth one is TMS therapy. TMS stands for transcranial magnetic stimulation. Is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. CBT is proven to be most effective among all the other treatments. If OCD is limiting your daily life or causing anxiety, help is available. See your GP who can refer to a psychiatrist. If you found today's topic interesting and useful, you can like, share and subscribe with your friends and family. Thanks for watching.